Hi, it's Dr. Jenn Kennedy. I'm a sexologist and couples therapist. The Pleasure Project podcast is about sex and relationships. So this includes discussions on desire, dysfunction, dissatisfaction, exploration of all things sex related. So sometimes I'll do toy reviews and we'll look at trends, and sometimes I'll also enlist other experts. We'll increase your insight and enhance your pleasure. So tune in. Hi, in this episode, I talked to Dr. David Wohlsifer, and the topic is autism and sexuality. So both of us are couples therapists, and we have both sat with quite a few autistic folks, and those are both adults and young adults who are either single or in longer term relationships. And so we're starting to just unpack, what do those relationships look like? What do those individuals who are trying to start dating, what are some of those challenges for those folks? We look at anxiety and social pressures. We look at internal and external factors. We look at some of the emotional aspects of relationships. We look at some of the typical markers of autism and how does that show up interpersonally. So I hope you'll tune in, especially if this topic is near and dear to you, and get some more information. And I would love your feedback. So tune in. Welcome back. My guest today is Dr. David Wohlsifer. Dr. David is a PhD in LCSW. He is a clinical instructor at Florida Atlantic University Sandler School of Social Work and coordinator of the Graduate Certificate in Gender and Sexuality. He is the founder of the Boca Raton Center for Psychotherapy. His areas of clinical practice include couple family therapy, CBT, substance use disorders, EMDR, and sex therapy. He has published in the areas of clinical social work, education, family and couple therapy, and sex therapy. So you are also the first person that I've ever had on the podcast twice.
Whoa, that makes me very happy.
Welcome back.
Thank you.
Our first episode was about men and sexuality, and it was very popular. So at the end of that episode, we had talked about having you come back, and I am so glad to have you back.
I'm glad to be back.
Yeah, so welcome.
Thank you, Dr. Kennedy.
We're both therapists. We both work a lot with sexuality, and more autism is coming in the room in various configurations. And I am so excited to have this conversation with you because I want to learn more. I have been learning more in preparation for this, but I'm excited to have you weigh in. Yeah. So welcome back.
Thank you. I want to begin by making one statement, and that is I'm coming here as a clinician. I'm not a person on the spectrum. I'm autistic, which means I'm not neurodivergent. I want to use politically correct terms and appropriate terms. And I don't want to speak for a community that I'm not a part of, but it is a community that I serve and I want to advocate on behalf of. So I want to put that out there. I heard somebody once say, no conversation about us without us. And I feel like I'm violating that rule today, speaking about people living with autism, autistic people. So I just want to put that caveat out there so that I'm respectful and put myself in a location that's appropriate.
Yeah, I think that's fair and important to name. I appreciated the book that you assigned me, which is so typical for you, right? We're going to have a conversation. You don't just give me an article, you give me a book.
I give you books.
But the author is autistic.
Yeah, he identifies as somebody that has autistic.
Yeah, perspective. So Unmasking Autism was the name of the book, if anybody's looking to get more information. And this is not, as they said, a monolithic group. So there's not one answer for any of these questions.
No. Heard a few good things. You meet one person with autism, you've met one person with autism.
Yeah.
It doesn't all look the same. And also that people with autism don't come to therapy to treat autism, they come to therapy with autism. Yep. So when I see a couple for sex therapy or an individual for sex therapy, I'm not seeing them for autism and sex therapy per se.
Yeah. Well, it's interesting because I have a group practice and we oftentimes do case consultation, and more this conversation has come up as we're conceiving, like how do we approach this case? And a lot of times it's couples coming in the door and autism is presenting in lots of different configurations. And how are we seeing it, in the couple's configuration? And it's like starting to spot it and recognize that it's coming in through low satisfaction, or it's coming in through, we have a big tech sector here in Santa Barbara, and we have lots of engineers. And, it's like, oh, wait, okay. So I'm starting to see a pattern of these really high functioning, very successful folks that are coming in that are in marriages, long-term marriages that have had some challenges. And, oh, wow. Yeah. looks like they might be autistic.
Yeah. And I find that a lot of people, especially the older they are, were not likely to be diagnosed when they were kids. Are they subclinical? They're somewhat neurodivergent, maybe not meeting diagnostic criteria for autism, yet their neurology is organized differently than their partners.
Yeah.
And that creates couple conflict. And particularly sexually, it can create conflict.
Yeah. Most of these guys are going to be 50 to 65 years old.
And interesting you said most of these guys, because I think we miss it. And I don't want to be binary to my gender conversation, but I'll use binary language. We miss it a lot of times in female identified people.
Yeah. Yeah. Yep, that's fair. Well, let's start out first of all by, I don't know if we can't define it like we like to define terms academically, but looking at sort of what is autism? It's not something we treat like you named, but we identify it and we help folks work within the system. So, what is it? And yes, it affects across the board, but I guess for those coming in cold, what is it?
Well, I want to expand the conversation even beyond autism, but to neurodivergence, where people are neurotypical and where they organized, like people with ADHD can be considered neuroatypical. I allow people to define for themselves who they are, but people with ADHD, people with dyslexia, and some other diagnosis can create neurodivergence. One of the things I look for are two different ways of approaching the work that I do. I work a lot with teens who will come in with an autism diagnosis, and they'll often come in for something different, social functioning, depression, trauma. And as we start working together, I start to incorporate neuro-friendly ways, autistic-friendly ways to help them understand things they're wrestling with. And there I'm coming in with somebody who has the diagnosis already.
Yeah.
What I'll find with couples in particular, I'll realize that the crux of the problems between the partners are the neuro differences between them. Mm-hmm. So for example, how they experience communication, touch, smell, time together, social reciprocity, all the things we look for in a diagnosis of autism, becomes an issue for the couple. And I don't want people to be pathologized for being autistic. I want partners to recognize that they've partnered with somebody that may have needs that are different than theirs. And those needs are to be respected the way any different need is in a couple. Make sense?
Yeah. Yeah.
So do you want an example?
Sure. I mean,
or we'll keep
there's
going.
So much to unpack in what you just said, right? Because
let's go with it. Unpack it.
The sensory stuff is going to be because highlighted, right? It's these are couples that have been together, and like the ones I just named, most of the couples I'm thinking of that have walked through our doors have been together for between 20 and 40 years. So these are couples that have long-standing, they've raised kids, and it was never diagnosed. Nope. So they're high functioning, they're earning, they're living their lives, they've gone through all sorts of stuff together, but they've had a level of differences, and they're coming in for some feelings of dissatisfaction or and it's like, okay, we've hit a point in our lives where we'd like to have better satisfaction in our couple. And then they start to name these differences that a lot of times come up in their sex life, and really they're actually coming up in several areas of their life that you just named. So talk about how, like, maybe through the sensory lens or through the ways that it would be illuminated perhaps in a coupleship.
I think it gets illuminated, if we're talking sex therapy, and I'm going to be very cliche, I think it gets illuminated in the living room and the kitchen before it does in the bedroom.
Okay.
So I'm working with, let's say, a heterosexual couple or a same-sex couple, and one of them says, partner one says about partner two, they don't want to spend time with me. They spend a lot of time on technology and time away from me. And it makes me feel, and I'm going to use Fishbane and Shankman's vulnerability cycle here. It makes me feel, it hits a vulnerability in me, where it makes me feel less than and rejected. And so I start yelling at them, and then I shut them down. And so what's happening here is the partner that is autistic or neurodivergent is being shut down, and it brings them back to a place in their childhood where they felt diminished and shut down. So they pull away, and you get in a classic distancer and pursuer. And when I start to realize sometimes that there's issues around autism or neurodivergence, I start to conceptualize as part of my work the neuro organization of the people that I'm working with. How are they wired differently, and what does that look like together? There's something I found across the board, and that is I find a lot of times that people who grew up in homes where there was a lot of expressed emotion, maybe alcoholic homes with a lot of DV, domestic violence, a lot of stress, are often very attracted to neurodivergent partners, autistic partners, because they're quiet. And it feels very safe to them. And so, like all couples, so sometimes we seek what we were missing in our childhood, right? We seek what we were missing, and so we pursue it, right? And we find that person who has what we were missing. So I grew up in this, not me, but though I actually did. But you grew up in a house with a lot of expressed emotion,
Yeah.
and it was stressful. And so you find this really calm person who's within themselves, and they play with their technology, and they don't make a big deal, and they do what you say. And the next thing you know, it feels very safe. But after 2 years, you start to seek where you grew up, and you start saying, why aren't you talking to me? Why don't you express more? Why don't you touch me more? And then you sometimes find that that also has to do with neurobiology and differences in neural structure of people.
Yeah.
Make sense?
Yeah. The technology thing does come up a lot, and that's interesting, right? The fidgeting. Sometimes people will complain that their partner's checking their phone while they're watching TV,
Mm-hmm.
or they're, crocheting while they're talking, or sometimes you
Or
see.
not making eye contact is a big one. And the
Mhm.
literature shows, though, that people who have autism, to actually make eye contact is actually painful.
Yeah, yeah,
I recently worked with a couple where I brought that up, and one of them said, it's so relieving to hear you say that because I've been forcing myself to be uncomfortable for years, my whole life.
yeah. And that sustained,
Masking, forcing them to
yeah,
mask. Mm-hmm.
doing it all day long. They do it all day long, and then to come home and to have to
Mm-hmm.
continue that.
Mm-hmm.
You mentioned the living room and the kitchen. So the kitchen's going to be another big sensory spot.
Oh, yeah. Yeah. Well, I mentioned the living room and the kitchen because I tend to think of them, though everything can go, as non-sexual spaces. So,
Hmm.
because you had mentioned people not getting along sexually, often in the other areas, when there starts to become conflict, everything the partner does is a problem. So, I met you and you felt so great. You're not like my high level expressed emotion house that I grew up in. And you're so calm and you keep to yourself and you're quiet. And I just talk and talk and talk and you're quiet. And then 2 years later, I'm mad at you for it. I pick on you for it. And you shut down because
Well,
that's how you cope. It makes
and I'm
sense?
thinking, well, kitchen wise though, I'm also thinking food
Oh,
preferences,
sure. Food
right?
preferences. Yeah.
And the sensory pieces of sometimes extreme
Hmm.
likes or dislikes,
Oh,
or
yeah.
the rigidity, or
Hmm.
the ritualization that sometimes can be associated with autism, and spicy foods. I know it can go either way, where there can be limits around food. Or one thing
Hmm.
the author said is that, and I'm actually, I think, realizing that my spouse is autistic through reading this book. I was like, oh my gosh, I think so. Is the really leaning towards really spicy food,
Hmm.
and that, like, wanting that
Hmm.
extra. So it's just, but places where that comes up in the relationship as a difference, and as a kind of, it might get labeled a quirk or a.
Yeah. And let's put it in the context of couple therapy, right?
Mhm.
So let's say you and I are a couple, right? And I cook for you and I don't make it exactly how you want it. I'm going to take that as a rejection as opposed to your neurodifference than me. And I worked all day, you know what? And I went shopping for it. And I started at 1 o'clock and here it is 7 and I've made it for you. And I wanted this evening and you're on your phone, right, the whole time. I made this, you don't like it. And you tell me, you
Yeah.
have some deficits in social reciprocity. And so you tell me, oh, wow, this tastes terrible. Throw it out.
Right. Because there's a tendency for the autistic person to be more direct in their communication,
Indeed.
and not have some of the niceties, not have some of the, right. It's
Hmm.
there's an honesty, but it's
Sure.
without some of
Hmm.
the social grace. And so it can land a little harsh, and
Yeah.
yeah.
And be offensive then to the autistic, autistic partner can be offensive
Yeah.
to them when it was never the intention of the neurodivergent partner to hurt the
Yeah.
other partner. And you see
Yeah.
this with ADHD too, right?
Yes.
The
Yes.
directness.
Well, the blurting, the
Hmm.
difficulty with patience and waiting in
Hmm.
line,
Hmm.
or waiting one's turn to
Hmm.
speak,
Hmm.
even, let alone waiting in line.
Hmm.
So then, as we jump into the bedroom with
Hmm.
all these habits,
Hmm.
right, the impatience or the bluntness
Hmm.
can where people tend to be a little awkward or a little more hesitant anyway. And
And
then,
more vulnerable.
yeah,
Hmm.
that can be even more tricky still.
Sure.
So for a couple that have been in a relationship for a very long time, it's one thing,
Hmm.
where maybe they've just sort of resigned to their corners. That's what we've seen in these longer term partnerships,
Hmm.
is that there's been more rote sex,
Hmm.
but they haven't, and they're coming into sex therapy, and it feels like an uphill battle to try to get them to try new things.
They're dissatisfied and they're having trouble meeting in the middle. And they're not getting along, like I said, kitchen and living room.
Hmm. Well, and the creativity and the spontaneity that we're trying to introduce,
Hmm.
super foreign
Hmm.
for the autistic person.
And when I think about my training as a sex therapist, it's all made at neurotypical people. It's all made at
Mhm.
autistic people, not autistic people. It's all made
Yeah.
for people who want touch, want partner touch, want certain kind of touch. Like think about the steps of sensate focus.
Yeah.
There's no neurosensitivity or neurodiversity in that at all. So I need another doctoral student to write a paper.
Yeah.
Since you already have your PhD, I need another doctoral student to write a paper
Yeah.
or your
You
next
think about that.
article
Yeah. If you unpack that, because
about autistic friendly sensate focus.
the touch can also be,
Hmm.
as I was reading the book and the talking about the touch and how sometimes autistic folks are really wanting touch and certain
Hmm.
types of touch, like the weighted blanket can be quite
Hmm.
helpful, that type of
Or
thing.
strongholds.
Yep. And then sometimes it's like any type of touch feels creepy
Hmm.
crawly, too difficult. And so it can be tricky in not knowing and not being
Hmm.
necessarily consistent in which none of us are necessarily always consistent in the
No.
quality of touch
And
that
then
we.
the partner is struggling close. Okay, last week you like this, like in any couple, and this week you don't like that.
I know there was also some mention too of there sometimes being a younger sense of sometimes the autistic partner being a little bit younger, reading younger, or kind of
Hmm.
their childlike qualities.
Hmm. Which
And
could be
that's,
really fun in somebody, right? I
mhm.
saw somebody today and he said to me, and I'm turning 44, and he's much younger than me. He said, I'm beginning to feel old. And I've worked with autistic folk who are, as they're getting older, still have a beautiful youthful charm to them.
There's like a sense of wonder and kind of,
Wonder and creativity. And again, I don't want to paint a wide brush. I really want to always go back to if you met one person with autism, you've met one person with autism. So please
yeah,
don't take anything I say for anybody listening as this is the one way. If you walk away with one thing from me today, just recognize that there's neurodiversity in couples and it shows up in sex therapy. It's all I want anyone to get from me.
yeah. I was thinking about too, as we talk about on the sex side of things, spontaneous desire,
Hmm.
and the trickiness that we already have
Hmm.
in spontaneous versus responsive desire, and
Hmm.
how that might show up for folks that are more inclined
Hmm.
towards routine
It
and
shows up as rigidity.
predictability. Yeah, that might be really,
So if I
really
give
hard.
advice to a couple where one of them or maybe both of them is somewhere on the spectrum and I say, I want you to be spontaneous, they might look at me and say, that doesn't work for me. And we like this on Tuesday and we like that on Thursday. So
Mhm.
let's honor it.
Even, I mean, that's scheduling, but even doing something totally different, like,
Hmm.
so that might mean that there's a predictability in what you're assigning them, that there's some sort of not agenda, but there's like some sort of agreed upon what are we doing, or where
Hmm.
are we doing
Hmm.
it, or how are we doing it, or how
Hmm.
long are we
Hmm.
doing it, that there's some sort
Hmm.
of containment that might be helpful, or I'm just trying to think of.
As long as somebody doesn't feel like they're being imposed upon. I
Mhm.
mean, all people in sex therapy never want to feel like we're walking away from the session being told, I have to do this.
Right.
Because what I do is wrong. I think that's really important that we never convey to our autistic patients that what they do is wrong. It might be unpleasant for your partner, but we have to be careful of trying to use like a neurocolonialism. I mentioned that in the last podcast,
Mhm.
that the only right way to be is neurotypical.
Yeah.
I always think I pronounce autistic wrong, but I think I'm not autistic.
Yeah, that's why I say neurotypical.
Yeah, I'm saying neurotypical and I might be
It's
dating
very-
myself. I'm going to use that languaging because saying autistic and autistic may sound too close in
it
the
does.
recording. Yeah.
Yeah, that sounds very close.
But yeah, we use a very neurotypical lens to sex therapy. Like I
Yeah.
said, think about sensate focus. It forces eye contact. First
Hmm.
thing, make non-genital. I mean, I never thought of this. Non-genital eye contact with somebody. Don't touch
Hmm.
anything. It's eyes only.
Hmm.
To somebody who experiences that as painful, you've just ruined the session. You've just
Good luck.
injured them. Yeah.
Yeah, so giving permission to people to close their eyes if they need to,
Hmm.
and let it just be
Hmm.
sensory, or maybe make certain requests about where they don't get touched, or
Absolutely.
which isn't typically how you would do sensate, but make that accommodation if that's part of
Hmm.
the couple that's sitting in front of you. Yeah, I think that's a great idea. So within the discussion, I think that's worth mentioning is the special interest piece, and the fact that for the one of the common pieces
Hmm.
of autism is special interests,
Hmm.
and so that could also apply to sexuality.
I'm making a note because you just brought up something I got to remind myself of. So go
Mhm.
ahead.
So special interest being that we see this a lot in kids, and there's so much more knowledge now around autism support for kids. We don't
Hmm.
have much knowledge for, seems like anyways, autism support for adults, but that's why we're doing this, right? Is
Yeah.
like, how do we
Hmm.
translate this and
Hmm.
then take it one step further,
Hmm.
autism support for sex with
And for
adults.
couples.
Yeah, and for couples specifically. So if we know that these folks tend to have special interests, and sometimes that can be lifelong, sometimes that can be
Hmm.
in little pockets, like right where it might be weeks or months or years. But if that then gets applied towards sex or sexuality, like how does that show up, and how might that be worked out within a coupleship? Hi, I hope you're enjoying the episode. Wanted to reach out to you. This is Dr. Jenn and say, hey, if you would like to deepen your own experience with this, there's a couple options. If you head over to pleasureproject.us, you will see several things. There's lots of articles. There are also merchandise items that you can buy if you're feeling enthusiastic. You want a tote bag. We've also got fun cookie cutters. You could also join the wait list for an upcoming Pleasure Circle, which is a small group intensive that I lead. Would love to have you. If you want to know more, check out pleasureproject.us.
I think the first thing you have to think about, is it a violation of the couple's monogamy agreement? So let's say the special interest is a fetish, and one of them, or not even monogamy agreement, sexual agreement, one of them, the partner finds that offensive. You've got a much higher impasse than if the partner says, well, you know what, that fetish might not work for me, but it's okay for you. Or, you know what, let me learn more about that. But that,
So in
go
that
ahead. Am
example,
I making sense with that?
well, like, so the partner A, like, suddenly has a fixation on what, feet, or
Yeah,
say something.
use feet.
Okay.
Yeah, and partner B, who might not be on the spectrum, says, you know what, I always think of three things when it comes to sex therapy that people can do. There's, we both like that, great. There's, I don't like that, but I'll do it for you. And there's, I don't like that, I'm never doing that. And that's my boundary, that's my limit. So
Yeah.
maybe we can find a way for people to be comfortable as partners without
Yeah.
breaking anybody's limits.
Yep. Yeah. And I mean, this is something that partners without an autistic
All the
person
time.
encounter too, right? Say one person, I mean, I've been in a relationship with someone who really liked oral sex a whole lot
Mm-hmm.
more than I did. And it was like,
Mm-hmm.
you know,
Mm-hmm. Mm-hmm.
it's a workaround, and you got to kind of think about it, and you got to do it,
Mm-hmm.
and it's one of those things where it's like, okay, this is something we have to,
Mm-hmm.
you got to balance the needs of both
Mm-hmm.
parties. So if there is a real fixation and the other person may or may not get on board for that, that might just be part of the
It's part of the
dynamic
couples therapy.
negotiation. Yeah. And so that would be something that would have to be
It falls in the
considered.
realm of regular couples therapy. I mean, people with autism, I'm sorry, autistic, one of my colleagues who is autistic corrected me on that. So I'm going to say autistic people.
Mm-hmm.
Autistic people will come with the same needs as other couples. But
Yeah.
there's something we're missing that I really want to speak about. Can I jump in with this one?
Sure.
And that is the sex life with the self. I work with a lot of people on the spectrum who are single, want to stay single, are not interested in romantic pair bonds, but have
Mm-hmm.
sex lives with themselves that I
Mm-hmm.
think a lot of mainstream therapists wouldn't validate.
Mm-hmm.
There's such a push to partner people. There's a
Yeah.
great book written by a psychologist who's single called Singled Out.
Mm-hmm.
Don't remember her name. It's a great book. And it talks about not pathologizing people who are single,
Yeah.
because our profession has taught us to do that.
Yeah.
And so I really want to give a special plug here that when we do work with people who are autistic, who are very comfortable being single, have sex lives with themselves, that we don't pathologize it. We don't send them right out to eHarmony or Tinder and tell them that's how they should be.
Yeah. Well, and also the correlative I wanted to name with autism of asexuality
Oh, yeah.
or transgender. Like years ago,
Which,
I had a colleague say
mm-hmm,
she was working at the university and she said, boy, this is just anecdotally. She said, there is such a high correlation.
mm-hmm,
I have a lot of transgender clients.
mm-hmm.
Many of them are also autistic. And I don't know, that's just anecdotally, but we've
There's
since
literature now.
much higher literature.
That's what started me working with people, because I do work a lot. I used to work a lot with trans youth. That's a lot harder now in Florida, but I used
Mm-hmm.
to a lot, and trans adults. And I found a number of them were also autistic.
Mm-hmm.
My own personal conclusion is that I think gender is a neurotypical construct. I think the concept of binary gender works very well for neurotypical brains and
Yeah.
not so well for neuroatypical brains. And so one of the fun things to watch when I've worked with some youth is to see how they can be creative with their gender expressions, and adults that are non-binary, not necessarily transgender, but their own. And I think that's really important to recognize and to validate and respect.
Right. Right. That they're not so hooked on or fixed in their
Mm-hmm,
identity in the
mm-hmm,
binary.
mm-hmm,
Yeah. I think that's a really hard concept for many people that are
mm-hmm,
fixed in the binary to understand, but that makes
mm-hmm.
a lot of sense to me, actually.
And I don't have to totally understand something to respect it.
Yeah, that's true.
And my first goal is to respect. So I've seen some youth, college age, come to my office, and what looked like transitioning goes in many different ways. And I think that's okay.
So the dating piece,
Mm-hmm, mm-hmm,
there's folks that have been in relationships for a long time that are now trying to kind of do this retrospective look, but shifting to the folks that are still in the dating
oh, the great
phases,
topic.
um, and all the challenges I mean, that's a whole different generation
Let's
now
talk about it a lot. Let's give a
with,
lot of space to it.
oh my gosh, right? Like trying to be, never mind that they went through COVID, never mind that the whole world has shifted to digital media.
Mm-hmm.
Like it's such a different time. And
Mm-hmm.
the challenges that an autistic person faces
Mm-hmm.
with reading signals, with
Mm-hmm.
flirting, with
Mm-hmm.
socializing, with peer
With
relationships,
attraction.
with reading signals in
Mm-hmm. Mm-hmm.
themselves, with
The rules
negotiating.
of what to do. Look, for everybody, I think I've been married 25 years. I would sooner eat glass than have to date again. I would sooner eat glass than have to date again. Because this is for anybody to challenge the nuances of what it means to meet new people. I was married before the internet came around, barely. But I can give an example. I was working with a young man once, and and I'm going to tweak this for privacy.
Mhm.
And he really wanted to, he was probably about 20, really wanted to meet a woman. Really,
Mhm.
really did. And a nice looking young guy, had a lot to offer somebody, strong career path. And he went to a restaurant, and the waitress was very professionally appropriate with him.
Mhm.
Very kind, very nice, but professionally appropriate. So he waited for her after he left work. So let me ask you, as a woman, if you were working in a restaurant and one of the customers was waiting for you outside after you left work, what might you do?
Think he was stalking you.
Yep, she went running back in and they called the police. He got arrested. And as we know, the police aren't always sensitive to people with autism. He had a complete meltdown. And when we met, he said to me, I thought she liked me. I thought she
Mhm.
liked me. And I thought I'd wait. He was thinking like a guy. He wasn't, there are different safety
Mhm.
rules. He thought I'd wait for her after work and see what happened. And he didn't realize that she felt threatened
Yeah.
and that the kindness she was conveying was really professional appropriateness of somebody in the service industry.
Yeah.
It'll work a lot on dating nuances.
Yeah. Yeah. It's reading things correctly and then also trusting, because one of the things I read in the book that
Mm-hmm.
was really interesting to me was that autistic folks consistently trust external objective information more than they trust their internal system.
Mm-hmm. They've been told they're wrong.
They've been told they're wrong
And they've
so much
internalized that.
that they've internalized it. And so they
Mm-hmm.
look for
Mm-hmm.
validation externally because
Mm-hmm.
they can't trust their
Mm-hmm.
own, probably, and that extends to
Mm-hmm.
their own somatic experiencing, their own body signals.
No.
They have to override it over and over again. So they don't trust what they want. They don't trust what they feel. They look for external signals.
I've seen that with a lot women who are autistic because
Mm-hmm.
they've been subclinical. They weren't diagnosed till they were older,
Mm-hmm.
but they spent years in their teenage years and young adult years and childhood years being told how they thought was wrong. How they were looking at X, Y, and Z was wrong.
Well, also because women are socialized to be a bit more quiet and
Mm-hmm.
passive
Mm-hmm.
and agreeable. And
Mm-hmm.
so many of those traits that
Mm-hmm.
are
Mm-hmm.
associated with autism in children get missed in women,
Mm-hmm. Mm-hmm.
girls, right? That they can
Mm-hmm.
just be, young and
Mm-hmm.
playful and sweet
Mm-hmm.
and quiet and.
And want to socialize with other girls, want to be out
Hmm.
there,
Hmm.
want to do typical play
Hmm. And parallel play.
and parallel play. And solitary play is, I think, in both boys and girls. And all children, solitary play is often pathologized.
Yeah. So girls get missed a lot. And then later on, it's like,
Mm-hmm.
wait, what?
But I think all of the people we're talking about all developed some tapes along the way that are some scripts inside that the way I think is wrong, the way I look at it is wrong. And they do give more credit to external validation. And so one of the things I like to do is help people build up their self-esteem stores and recognize that a lot of their intuitions are quite good and don't need to be devalued. Another thing I work on a lot with dating is around directness and sexual appropriateness. So for the sake of confidentiality, I'm going to tweak this example a little bit. But I was working with somebody who really liked girls' legs, really liked girls' legs. And so he would go up to them and say, I like your legs. I'd like to take a picture of them for later.
Oh,
And
dear.
that was very threatening to the girls he was saying this to, the women, this kid that he was saying this to. And then he got himself in trouble, got in trouble at school for saying this. And so we had to work there on having boundaries, being appropriate. He said, but I like them. I said, well, you can't be direct. And I also, with a lot of kids, have to work on protection from perpetrators because some of the nuances and stranger danger,
Yeah.
they can easily get hurt.
Yeah. The willingness to sort of trust and
Mm-hmm.
the
Mm-hmm.
awe, the curiosity.
Mm-hmm.
And then as they become teenagers and young
Mm-hmm.
adults, that desire for
Mm-hmm.
closeness, that desire for acceptance.
Mm-hmm.
And by that point, sometimes there's been some bullying, there's been
A
some
lot of
mockery.
bullying.
And so then there's this mistrust of self, but there's also
Mm-hmm.
mistrust of peers. But
Mm-hmm.
there's a hungering, because
Mm-hmm.
one of the things the author said was that they are sometimes susceptible to being swept up in cults
Oh,
or
yeah.
in religious, type things, because there's this hunger for community and
Mm-hmm.
for acceptance. And so it's a little bit tricky. And if you think about that as a setup for dating and how
Mm-hmm.
much desire there is
Mm-hmm.
for acceptance and
Mhm.
interest and sexual energy coming at you might be a
Mhm.
little hard to negotiate.
It's really overwhelming, I think, for a lot of people we're talking about.
Mhm.
It's overwhelming for people who are not autistic as well as who are.
Yeah.
And
And the
then,
emotional processing piece
mhm,
of,
of not getting the nuances of certain emotions, facial expressions, situations.
yeah, what am I feeling? Oh, is this supposed to
Mhm,
proceed?
mhm,
Am I allowed to touch
mhm,
you? How far
mhm.
is this supposed to go? Am I
What
allowed to
does
set
consent look
boundaries?
like? Yeah, what does
That's
consent
so
look like, both
simple.
mine and yours?
Yeah. Consent is a big question,
Mhm,
right? How do I know that you've said yes if
mhm,
if we're not asking direct questions, because direct
mhm,
questions are
mhm,
too mechanical, right?
mhm.
That is a difficult question for
And
young
if I
adults.
have issues with social reciprocity, how I don't know what I'm doing you like if I hear you, and how do I convey to
Mhm.
you my boundaries,
Yeah.
especially if I've been told the way that I think is wrong. Am I even allowed boundaries?
Yeah. So how do you work with young adults around these topics?
Depends where they're at in their life.
Hmm.
Depends what brings them into me. Sometimes when I get some teens, they've been brought into me because something has happened. They've done something, like boys. I tend to get more boys than girls. They've done something. They've been brought into counseling to fix this behavior so they're not asked to leave school. And so we start to look at the behavior. And often what I find is somebody who didn't realize that what they did was problematic because it didn't quite make sense to them. Like the example around the legs or the
Hmm.
waitress. They didn't quite get. He said, I thought she liked me. And
Yeah.
helping people work through the social skills of dating from an autistic lens. I mean, we do this with people that aren't autistic all the time too, right? How many conversations you have with people, young
Yeah.
people, about relationship building and connection, workplace connection, how to act in a workplace, what to do.
Yeah. I'm even thinking of, the folks that are 40 and 50 that are back in the dating pool
Mm-hmm.
that are likely
Mm-hmm.
autistic, that are like, oh, man, how do I negotiate this? Because
Mm-hmm.
oftentimes, if they've been paired up and they're back out there, their partner has been doing so many compensatory
Mm-hmm.
things. And so they don't
Mm-hmm.
know how to do this.
And also, the autistic person has been masking to a
Yeah.
level that we know that masking increases suicidality, increases depression, increases anxiety. They've been forced to
Talk about
mask.
masking for a minute. Just kind of define that.
I remember when I first started practicing with autistic people, there was this belief that we were supposed to try to make them act not autistic, think not autistic,
Mhm.
and we abused them. It's like a conversion therapy. I've been told that the
Mhm.
person who invented ABA is the same person who invented conversion therapy. I think that's referenced in the book, right?
Yeah.
Conversion therapy for gay and lesbian bisexual people, make them
Yeah.
straight. And the same thing with make people on the autistic act not autistic. And it's torture, it's abusive.
Very cruel. Yeah.
It's very
Basically
cruel.
force them to not do it. But yeah.
Yeah. And so I think it's so important that we don't encourage masking with people, that we encourage them to be show up as their authentic selves.
Yeah.
We embrace their authentic
Masking
selves.
being literally putting on a mask
So
and
I
countering and resisting
force myself to have eye contact with you, even though I hate it.
that urge to do those things, that because basically it's learned behavior that overrides their natural
Hmm. Hmm.
tendencies and urges. I mean, it's like, and I can imagine how exhausting it must be to be
Sure.
monitoring, self-monitoring all
Well,
day long. Most
we've
people
all
can't.
had to do it in our lives, haven't we? All had to self-monitor our boundaries, our limits. But imagine doing it in every single nuance while holding the core belief that who you are and the way you think is wrong.
Yeah. And so if you think about that, then in a dating
Hmm.
scenario or in a partnered scenario where you're trying to, what we normally ask as sex therapists is for you to drop into your body and to
Hmm.
be authentic and to be vulnerable. But at the same time,
You
you're also
can't.
monitoring your
Hmm.
every move
Hmm.
and
Hmm.
the way you're holding yourself,
Hmm.
and you're
Hmm.
not,
Hmm.
it's like, good luck.
Yeah. And the way you take care of yourself may not work for the way some partners like people to, but it feels right to you. Certain textures, fabrics, soaps, issues around grooming may not work for you as an autistic person, but it's being imposed upon you, and sometimes you have to as a partnered person. And
Hmm.
how do you navigate that?
Yeah.
Are all things that will show up in the therapy room. I find one of the biggest things where I start to notice, especially people who have never been diagnosed, is when there's this sort of mismatch around attunement. Think of attunement as emotional harmony, my
Hmm.
ability to feel felt by you. Makes sense? And one of the things I find is that the non autistic partner will also often complain of not feeling, my words, not theirs, attuned. Like, you don't get me. You don't make me feel empathy. You don't make me feel connected with. And
Yeah.
those words may not make sense to the autistic partner, or they might be looking at them very differently, but they are being maligned in that process. They are the bad guy. for
Mm-hmm.
not attuning, not connecting. And I think one of the things I like to do with my students is train them to think about people in their social locations neurologically. Like we talk about understanding diversity. How does race, sexual orientation, gender, age, class impact a case? Well, how does neural status impact case?
Yeah.
How does neurodiversity impact a
Well, and I
case?
think sitting with a person, this was in the book too, is it makes sense to me is that when non-autistic people encounter somebody who is autistic,
Mm-hmm.
there's a sense that something's off,
Mm-hmm.
but they don't know what it is. And so sometimes it can create some like sense
Mm-hmm.
of unease. But if they know that it's there and they're aware
Mm-hmm.
and that frame
Mm-hmm.
is presented up front,
Mm-hmm.
there's so much more permission and there's curiosity and there's
Oh,
just like,
yeah.
oh, okay, that's what's happening. So when the partner is made aware of this is why
Mm-hmm.
it is, and you know there's quirks, but the quirks are
Mm-hmm.
explained by that frame, then it's like, oh,
I'll
okay.
I'll give you an example. A woman once said to
So
me,
much more sense.
a woman in her 60s once said to me after learning that her husband was what we used to call Asperger,
Mm-hmm.
which now would be like autism level 1. When she learned that, she said, "Oh my God, for years I thought he was an asshole."
Yeah.
She said, "And now I realized it was just his neurology, and I really like him a lot now that I get him." And she
Yeah.
said, "I understand why I chose him. He was emotionally reserved, very different than what I grew up with. But I
Yeah.
experienced that as an asshole until I learned this, and now he has permission to be him, and I can love him differently knowing who he is."
Yeah.
And I thought that
Well,
was so great.
there's all these little things of like, well, I had a couple of those aha moments myself as I was going through the book of just like, that's the fidgeting, or that's the
Mm-hmm.
having to eat the same thing, or
Mm-hmm.
that's the,
Mm-hmm.
the rigidity around this, or
Mm-hmm.
that telling the same story, or that's the, and I was like,
The hyperfixation.
special interest. I was like, that's what that's called.
Mm-hmm. Mm-hmm.
Oh my gosh, that's what that is.
And I want to bring up one caveat. I have a number of cases where both partners, I do probably 50% of my practice as couples, where both partners are somewhere on the spectrum.
Yeah.
But they're different people. It's not the same thing, right?
Yeah.
One person with autism, you've met one person with autism. And how
Mm-hmm.
does the differences in the way they are organized play out in
Mm-hmm.
their relationship
Mm-hmm.
is
Yeah.
something that we always have to look at.
Yeah. Well, I might have some ADHD going on, but maybe. Yeah. So it's interesting because the relationship is not, or, the goal within couples therapy, I would say, is not to fix person or,
No.
fingers. It's like, how do we fine tune the system so that we
Mhm.
understand better what's happening to increase
Mhm.
everyone's satisfaction?
I think
Right.
I do my worst work when I try to fix anything. I
Yeah.
fail at it miserably. I think it's minimizing. I think the best thing we can do is give space to any person who comes in our office. Because where do people have space to explore who they are really safely other than in our offices?
Yeah. Yeah. Because I mean, sex is about play. It's
Mm-hmm.
about inclusion. It's about trust. It's about
Mm-hmm.
exploration.
Mm-hmm.
And to get to that place, there has to be, like you
Mm-hmm.
said, you have to feel known and you have to
Mm-hmm.
feel accepted by partner and by
Mm-hmm.
self.
Mm-hmm.
And so to get
Mm-hmm.
there has to be that kind of environment created.
Mm-hmm.
So hopefully that's what's being fostered.
And then a couple can grow together emotionally, sexually, relationally on so many levels when there's awareness of that, all of that.
Yeah. Well, thank you so much. I appreciate this conversation.
That went fast.
Yes, it did. Okay, so if you want to reach Dr. David, he is at drdavidw.com. So thanks again. Appreciate it.
All right. Thank you. Thanks for having me back on your show.
Absolutely. Hey, it's Dr. Jenn. Thanks so much for tuning in. Please leave us a review and leave a comment if something struck you. We'd love to get the feedback. It really helps the podcast. And if you want to reach me, go ahead and direct message me on Instagram, or you can reach me at jen@rivieratherapy.com. Thanks.